Okay, we're going to jump right into it. It's 10 o'clock. Hopefully, I'm not missing anyone else that is in the waiting room. And again, we're going to have Q&A at the end of this. I do encourage um, people to put in their questions. I really do. I learn when I do a lot of these webinars from you. So I do appreciate people being able to have the opportunity to ask questions. So utilize the chat. When we get to the Q&A section, we're going to dive right into it. All right. And again, this is recorded. It'll be available for 48 hours. And I just want to welcome all of you. Thanks for joining me today. I'm very excited to discuss this like wild world and really rapidly evolving field of metabolic medicine. It's really truly a hot topic, I feel like, in healthcare right now. I know that many of my patients are asking about these GLP-1 medications. And as acupuncturists, we have this very unique opportunity to serve as these consistent guides and advocates for our patients really throughout their treatment journeys. So, we're seeing our patients really regularly during their care. Ideally, we're seeing them even weekly, and if not more. And we're positioned to offer comprehensive, holistic perspectives on these new medications. And, we can really provide our patients with very thorough information about benefits, risks, and just support them wherever they're at, regardless where they're at in their health journey. And whether they're considering getting on these medications, I have a lot of patients asking me about them before they do start them, or if they're curious about starting them. I have patients experiencing a lot of side effects while they're on them, and or they've been on them and they really want to get off of them. They're ready to discontinue them entirely, and we can be that support for them in any of those versions of the treatment plan. So we also just can fill kind of a crucial role because really frankly, a lot of these doctors and these telehealth clinics that are prescribing these medications, they aren't providing ongoing monitoring, and they really aren't providing guidance that the patients do need when they're prescribed medications like these. So today I want to explore how best we can serve our patients in this capacity. Okay, so a little bit about me. What brings me here today, I'm Dr. Jessica Parker. I'm the owner and acupuncturist of Root and Stem Integrative Chinese Medicine. Give me one second. I'm just trying to make sure I'm letting everyone into the waiting room. I have more people here. Again, I don't have my assistant today, so I'm all me. And I've been practicing acupuncture, Eastern medicine, and functional medicine for about 15 years. I have a variety of experiences that sort of led me to where I am now with bringing and incorporating integrative medicine like lab work into my practice. So I had the experience, I actually lived in China during my undergrad. So I not only had the experience as an acupuncture, student later on to work at Zhejiang Hospital. I also was a patient there in my early 20s. And my work there as a student, though, it really did reveal how true integrative medicine transforms healthcare. I witnessed how really bringing together different healing traditions, this creates this comprehensive support. Patients are so much more better served when there is a comprehensive integrative approach. During my doctorate, the DAOM with 5 branches in 2016, I was in the first cohort for an acupuncture resident program at Highland Hospital in Oakland. And honestly, it was very disillusioning for me. It was just an intense view of how unbalanced our Western medical approach is. It is disease management, it's complication management. There's very little healthcare happening in many of our Western medical hospitals today. So I've really because of those experiences, I've really pulled in and dove into combining conventional lab testing with Eastern medicine. And I have found this has really been able to provide my patients with very clear, actionable insights. We can see the microcosm of the body in their blood. We can read labs just like we read pulses. And by no means, this is lab work too. So very, very valuable. And again, as acupuncturists, we're able to offer that hands-on approach. We're feeling what's happening in the body, on a really consistent level. So we are there to be able to provide that guidance for our patients, unlike many other approaches. And I have really, again, embraced the beauty of lab work. We'll talk a little bit about that. I have a fall cohort coming up starting September 17th. And it's really my jam. I love talking about labs. So we'll talk about how to look at some lab work if it does come across your desk with your patients, if they want you to look at anything while they're on these GLP-1 medications, what you can look for to help added support. I've recently also sort of added teaching hat to my list here, and I am now also the curriculum developer and faculty with ACCHS in Oakland for their integrative medicine program for the Bridge and the DAC programs. Those will be launching in 2026. But I've been teaching there for of the past year. I love teaching. I love being able to learn from others. So again, please make sure to use the chat and we'll dive into questions in a little bit. So learning objectives today, we're going to start with what are GLP-1 medications, really looking at them from multiple perspectives, and how to really evaluate these benefits and risks through both the Eastern medicine lens, the functional lens. What are some potential pros with these medications? I am seeing some benefits. I certainly have a lot of concerns, and I'm certainly concerned about long-term effects of these medications, but absolutely no judgment. And these can be somewhat of a bridge tool for some people. So let's look at all of the perspectives here, how to develop treatment plans that are really integrative for our patients. And again, we're here to be able to give our patients the informed decisions so that give them the information so they can make these informed decisions about these medications. Again, no judgment to them. We're just here to give them all of the information so that they can find out what's right for them. So why this matters, again, this is like a huge shift in metabolic medicine. It's happening really quickly. It's here to stay. I don't see these going away anytime soon. Both Eastern and functional medicine really provide these root cause analyses, right? So we're looking at what's happening at that deep root level. We want to understand how to support people's, whether it's digestive systems, whatever's going on metabolically with them. We want to see what's happening at that very, very deep level. These medications can help with an integration of more comprehensive patient care. There's no one single approach really that has all the answers often. So again, we can provide more of a well-rounded approach at this. And as we all know, patient individuality, it's really important. Like that is such a big, true piece of our medicine. And what's really powerful is that each individual person is different and they respond differently. So we're again there to be this supportive sort of crux for people if they are getting on or off these medications. And we're always looking for prevention. We're always looking to sort of optimize the body rather than just symptom management. And again, I have respect for both innovation and tradition. There's certainly some things I would love for people to not have to get on. I love reading studies, even the boring ones, but I think that it's really important that we fully understand how, again, there's pros and cons to all of these medications, and we'll dive into that. So kind of just getting into the fundamentals, like, again, we're going to start talking with just what are these medications and what we may be seeing or hearing in our clinic today. So GLP-1 receptor agonists, they are glucagon-like peptide 1. So this is actually GLP-1. It is a hormone produced in the intestinal cell walls when we eat. It is responsible for metabolic regulation, so it helps with getting glucose into the cells. It helps with maintaining that stable blood sugar level. They naturally, again, we're talking about the actual hormone that is naturally produced here first. They help slow digestion. They are helping to inhibit the liver's glucose production, slowing how food moves quickly through the stomach. This ideally, when it's functioning correctly, we are hoping that that slowness is going to signal satiety to the brain. So there's less of a need for then, oh, I need more food. I want have more food cravings. The receptor binding, so the GLP-1 receptor agonists, these are the medications that we're talking about. They go in and they attach to the same cellular receptors as those natural GLP-1. So they're kind of coming in to fill in those spaces before the body is making those GLP-1s on its own. And ideally, that's amplifying the body's beneficial metabolic responses. So ideally, it's sort of helping the body work a little bit better at handling food. Also, again, there's a lot of study and research out there that they do indirectly improve how cells respond to insulin. So we're again assisting in that blood sugar management. Probably one of the biggest things I see in lab work is blood sugar dysregulation. People are eating, even with people that are eating an incredibly well-balanced meal, if their digestive system is off, if they have spleen qi deficiency, liver qi stagnation, their digestive system isn't communicating correctly, their body doesn't have the ability to understand how to manage proteins, how to manage denser, thicker substances like cholesterol and fat. So it's going to try to prioritize glucose, again, in a well-balanced meal, because that's easy to digest. That's easy to support a stressed out system. So I see that a lot. I think blood sugar dysregulation is one of the biggest key issues that I see when we're looking at labs. They're, again, eating a really good meal. They have all the bases, but their body just wants to get that quick fuel. So a lot of what I do is helping try with supporting the patient's body through herbs, acupuncture, and a variety of other herbal treatment plans. We're trying to get the body to communicate, that digestive system to communicate better so that it understands how to absorb all of those deep, dense nutrients and not just go for the easy sugars. So what these medications do is sort of help stimulate that in a way. These are medication types. I'm not going to go through all of these, but I just want you to have an understanding of some of the names. You'll see the semaglutides like Ozempic. That's probably the most popular one. That's the one that I hear a lot of. Wegovy is another one. Those are generally injections. So they're a weekly injection. They're the longest acting with for those sustained blood levels. And they are the most studied for cardiovascular benefits. A lot of these medications did come about trying to manage type 2 diabetes. So there's also a lot of research on how they, again, support the mechanism of utilizing insulin. Again, I'm not going to go through all of these. These are just other names that you might see. Your patients, they might be taking other types of medications. So how they work in the body, I think is just, again, it's so fascinating to me because I think a big piece of what I'm trying to do is actually kind of what these medications are coming in and doing. So we really are trying to just start with waking up that digestive process in the mouth, stimulating the acids or stimulating the enzymes in the saliva, waking up the pancreas, stimulating the acids in the stomach, getting the body preparing for food. So what happens here with the GLP-1s, they stimulate that pancreatic function, releasing insulin when glucose is elevated. They also are suppressing glucagon if not needed and helping with that beta cell function. So they're helping stimulate that pancreatic activity. I find so many of my patients are on the go, rushing around. So many of my patients, including myself, I'll put myself in this category, forgetting to eat, taking big gaps in my day, grabbing something on the go, chewing really quickly, not really deeply masticating food. Over time, this really slows down and sort of wreaks havoc on that gentle communication, again, between saliva, between the pancreas, between the stomach. And so then the body, again, is just going to be only prepared to know how to manage and handle glucose. So this helps now slow that down, stimulating that insulin release, slowing down that gastric emptying. Again, with that slowness through the digestive system, certainly has many side effects, but when working correctly, the idea it's increasing the satiety signals. It's telling the system, hey, I'm full. I have a lot of food I'm working on right now. I don't need to keep eating. And ultimately will reduce meal size naturally. Again, with that brain communication, it acts on the hypothalamic appetite centers. It's reducing the food reward pathways. It's sort of helping with cravings and binge eating. I have a lot of patients of mine who were very, very concerned about getting on this and really identified with their bodies and didn't really want to dive into the world of, this medication to lose weight. It was very challenging for them emotionally. And then when they did do it, one of the biggest pros I'm hearing from many of my patients is that, wow, it quieted this food craving conversation that I didn't even realize I was constantly having. And so again, it's helping with that brain communication, telling the body you can slow down, you don't have to keep eating, your body is satiated. So metabolic effects, again, improves that insulin sensitivity, reduces inflammation markers. I see a lot of inflammatory markers. We'll look at some of the labs that show some fluctuations in inflammation. And I am seeing inflammatory markers start to go down for many of my patients. A lot of it, again, is just that metabolic effect. The body is working a little bit more streamlined. And it may improve cardiovascular outcomes. So there's lots of research on that as well. Here's some FDA approved uses on and off label. I kind of just wanted to point this out. Again, it's, type 2 diabetes management. Always with our medicine, right? We want to try to keep people from getting to that point of type 2 diabetes, which is what we can do when we're really working preventatively. And many people are just stuck in that cycle, and they need that support. So this has been approved and initially studied for type 2 diabetes, chronic weight management, cardiovascular risk reduction. And that's another piece of where many of the studies are coming from. Common off-label uses, I don't know about you, and maybe it's just because I study this stuff, but like my Instagram is crazy now with all these GLP-1 medication, like telehealth that I could just buy without even really a prescription. So there's a lot of people selling these medications, but they are often used for pre-diabetes prevention. Again, ideally, we want to keep people from getting into that state, looking at metabolic syndrome far before it becomes diabetes, but that's what people are using these medications for. PCOS management, I've been seeing, eating disorder support. Again, it's quieting that craving response in the brain. And again, metabolic syndrome treatment. The population right now, it's 12 million Americans prescribed and counting. Right now, there's a shortage. People can't even get them right now because they're so popular. So I think what's the most important about jumping onto this webinar today and understanding what's going on, these are not, like I said, they're not going anywhere. If anything, they're getting more and more popular. We need to be there to provide that underlying support for our patients, regardless of, again, where they're at in that journey. Current limitations, high costs, there are insurance barriers really right now, supply shortages, like I said. I put bold here, long-term safety data still emerging. I think this is probably my biggest concern. They're very still new, and I certainly have a lot of concerns about anything that is changing the communication of the digestive system. While it does seem to be changing it for the better, what is the long-term safety on this? What is going to happen when our bodies rely on this outside medication in order to just communicate and eat food, right? And digest food. So that's my biggest concern ultimately. And here, this is the potential side effects list. It's huge. There's lots of side effects. There is just no doubt that, again, as we know, all of our patients are different. They're going to process medications different. They're going to process food different. And there are a lot of potential side effects the most common that I'm seeing for my patients on these medications is usually diarrhea and constipation, one or the other, more extreme than the other. And for some of my patients, it's been severe enough where they actually had to stop taking them. And for others, they're just trying to power through it, and we're supporting their digestion so they have less of these side effects. But those are very, very common. And we'll talk about a case study at the end here that goes into one of my patients who did ultimately have to get off the medications because of really chronic diarrhea that kind of wreaked havoc on her life for a while. Injection site redness, that's something I have heard a little bit, but generally it's something minor. Decreased appetite, that's an intentional effect, but that has changed again the way that people identify with their bodies and their health and their sort of day to day. Suicidal ideation. This is a newer report that has been coming out. There is no causal relationship that's established at this time, but more and more reports are being documented. So it's something that's being taken pretty seriously. Pancreatitis risk. Absolutely a side effect, potential side effect. So really watch out for those red flags like severe abdominal pain, spreading to the back, nausea, vomiting. This requires immediate attention. Hypoglycemia is something that I'm also seeing. It is a potential side effect. It's often a bigger issue when they're combining any sort of type 2 diabetes medications too. So you have to be careful and make sure that your patients really, really are paying attention to the other medications that they're taking. Because so many of our patients have a million different specialists that are all prescribing them different medication, and there isn't one person there to sort of guide them with all that medication. We can at least be there to make sure to monitor some of that. Obviously, we're not prescribing any of these medications, but we can at least be very informed about how these medications work together and be able to, prepare them for potential side effects, and know when to say, hey, you need to go to your doctor right now. It looks like you're having an adverse reaction from those medication combinations. Thyroid cancer risk, it is a very real and serious potential side effect for people that have any sort of family or personal history of thyroid cancers. So diving into the integrative medicine perspectives, we're going to look at, I'm just going to jump into the next page really, both the functional and the Eastern medicine principles here. And so when I say functional medicine, I think I'm really using the term loosely. Functional medicine and integrative medicine, root cause medicine, which is what Eastern medicine is ultimately, right? That's all, we're always looking for the root cause. So why is that metabolic system dysfunctioning in the first place? What is happening with that communication? What's been going on for maybe years? What's happening? What led to this insulin resistance in the first place, for instance? Systems thinking. This is what's so key about us as Eastern medicine practitioners. We understand and recognize that all of the organs are in the same body. I think that this is still something that Western medicine is a little bit behind in. The head is attached to the body. Our liver and our stomach are all two different organ systems that work together. The thyroid, the pancreas, all of these come together, right? How do we look at all of those organ systems, the spleen, and really build on a treatment plan and support our patients, understanding that each of those organs work together and they're in the same body? How is the gut health affecting metabolism? How is the thyroid? It's a big piece. How is that the conversion of T4 to T3 in the gut? What's going on there to support the thyroid? All of those are connected. And then again, individual biochemistry. So each person, they're unique. They're going to respond to medications differently depending on their constitution. Someone with severe spleen qi deficiency is going to have a different reaction than someone that has kidney yang deficiency or liver qi stagnation. So we need to be paying attention to those patterns. And then prevention and focus. Again, how do we optimize the body before it gets to that disease state? A lot of my patients, aside from GLP-1s, we're looking to support them before they get diabetes. We don't want to wait until that number is outside of the range and they are then requiring to need some sort of insulin. Other questions too, we're asking what's going on with their stress levels? How is their sleep? What kind of toxins are they exposed to? A lot of my patients, I'm navigating home products, household products. Like what do they have in their cupboards that could be potentially irritating their system, increasing inflammation, and really stressing out that liver in order for the body and the digestive system to work better, and really understanding the underlying causes. And again, how do we support the body's natural GLP-1 production? We can do that too. So, a few other things and places to look at, again, where I think this is where us acupuncturists and Eastern medicine practitioners are just pretty badass at. I mean, we are looking at pre-heaven chi. You know, what are these other genetic polymorphisms? MTHFR is a mutation that makes it difficult for people to absorb folate. APOE4 is also a genetic disposition to Alzheimer's disease. So we want to be paying attention to these potential other issues, family history of metabolic disorders, early life and trauma. There's some amazing studies of how even trauma from that follows through generations and how it changes our DNA. So our great ancestors going through famine or war, how does that affect their DNA down the line into our bodies? And we want to pay attention to that. I always ask a pretty detailed chronological health history with my patients. I want to know what affects them, what's been going on, in their lives that could be, affecting the way their digestive system has developed. And that prenatal early childhood nutrition too, of course. Triggers, so chronic stress, cortisol dysregulation. I mean, how many people are just totally over bombarded with too much information? Cortisol dysregulation. How many people are intermittent fasting and not eating in the morning, which is during the spleen and stomach time on the clock, and their cortisol is going through the roof. Their body needs more nourishment at that time. They're thinking that they're trying to do something really good for their bodies, but they're really wreaking havoc on their adrenal system. So how do we support them in places of chronic stress? We want to get them into that parasympathetic mode, that rest and digest. That's when that deeper level of healing will happen. Gut microbiome disruption. I see this all the time in lab work, a really simple set of labs. You don't need to do crazy SIBO tests or stool sampling tests. You can see in a very basic blood draw what's happening in their microbiome. How is their signs of dysbiosis? Is there signs of SIBO? Things like that, small intestine bacterial overgrowth. Again, environmental toxin exposure. We want to make sure that they have clean products in their lives, that they aren't exposed to toxins either in their house or where they work. Other infections, do they have a chronic viral infection like EBV that their body has been constantly fighting all the time, putting that strain and inflammatory response on the system, making it harder for the digestive system to work. And again, major life transitions or trauma. And then the mediators, sort of ongoing contributors, again, chronic inflammation, insulin resistance, leptin resistance, oxidative stress, nutrient deficiencies. Are they even getting the deep nutrients that they are trying to get from food? Are they able to even break that out? Or break that down and really absorb and get the benefits from the food that they're trying to give their bodies? Certainly sleep dysfunction, again, chronic stress patterns, kind of reiterating how important it is to have a regulated adrenal system. Okay. And I think that it's important too that we think about these medications with some benefits. I'm seeing some patients this has been transformative for them. Yes. Are they chronically constipated and we really need to work on that for them now? But I've had patients that have really been able to shift out of chronic patterns that have been hard to do without. I call these bridge tools, right? So, these metabolic benefits include reducing that inflammation, highly sensitive C-reactive protein is a test that's a really good inflammatory marker. I always add to labs. That can really help us understand what's going on in the body and as far as inflammation. These do improve insulin sensitivity, helps break cycles of insulin resistance, supports weight loss. So I've had patients that are like, you know what, for the first time, I finally can like get down on the floor and play with my kid, and that's a huge shift for them. And it's beneficial in the sense that they are able to use their body in the way that they want to. And again, there's a lot of studies on cardiovascular prevention and protection. Cardiovascular disease, of course. So functional advantages, again, breaking these vicious cycles. As I've mentioned many times, I'm hearing a lot of that from my patients. They're noticing this interruption in their food addiction, reducing that oxidative stress, decreasing cellular damage, improving gut health. I'm still a little nervous on that end. We'll talk a little bit more about that, but I think that the microbiome is so key for a variety of things in our body, and it regulates the thyroid, it regulates stress, it regulates so much. There's some evidence that it benefits the microbiome, and I'm very concerned, again, the overall long-term approach, changing the way the digestive system communicates, how that ends up in the microbiome. We'll talk a little bit more about that. But again, sort of rewiring those food reward pathways and that neuroplasticity support. So again, as I said, I like the term bridge tool. I use this a lot with my patients. There's many medications out there that I see as a bridge tool. So maybe they're in a place that's really needing almost immediate support. And my patients want to work on the root cause. They want to work on the root issue, that's slower medicine, right? And that major shift in their metabolism, major shift in diet and lifestyle changes will take a long time. And they can use these medications as a bridge tool to provide that stability while we continue to address those root issues. Harm reduction, preventing further metabolic deterioration. So helping patients, if they're in that place, they need to kind of get out of a more inflammatory state in a quicker way than what might take time with using functional medicine tools, Eastern medicine treatment. And then quality of life, again, some more pros. As I mentioned, I'm seeing people just like, wow, I'm in a different place now, and this has been really beneficial for me. Concerns, many concerns. There's some potential drawbacks too, symptom suppression. Just taking these GLP-1 medications are not addressing underlying dysfunction. They're helping support that communication. But again, what happened in the first place? How did it get to that place? Dependency risk. It's again, if you're not addressing why there's dysregulation in the first place, the body is going to start to depend on it, need more of that potentially. And if they get off of them, is their body going to go back into that imbalanced state? Incomplete healing. Were there hormonal issues as part of this that weren't addressed? Those are going to persist. Are there liver detox issues? Were there gut microbiome issues that weren't addressed? This incomplete healing is a big piece why we need to be paying attention to that for our patients. And then physiological concerns, again, constipation is a big one. Extreme diarrhea, IBSD, digestive dysfunction, this slowing that gastric emptying potentially will affect how the body is actually absorbing. It's a very big shift for the body to do in such a rapid way. Muscle loss, so rapid muscle loss can also, rapid weight loss can also include lean muscle mass, nutrient deficiencies. Again, not eating enough food that may actually worsen an existing deficiency, a blood deficiency, an iron deficiency that they weren't getting in the first place. Now we're slowing the way the body can even handle it. And they might not be getting that deeper level of support and nutrition. And then again, I'm just concerned about the gut microbiome sort of long-term effects. It's unknown, how is this going to shift that? More concern, system impact, again, how is this going to affect the stress response, cortisol patterns? If people still aren't eating in that morning time, that Chinese window, they're doing Chinese medicine window, and they're not giving their body the need during the spleen and stomach time of the day. What's going on with that cortisol? Again, it's an underlying root cause that isn't being addressed. Thyroid function, so weight loss and changes in the digestive system really impact T3 conversion. We need to convert that thyroid hormone in both the liver and in the gut. And if that rapid weight loss is happening, that can really affect how T3 is converted. Sex hormones, rapid fat loss, that can completely impact hormone production. Fat and cholesterol, those are the building blocks for our hormones. We need to make sure we're getting that adequate levels of those building blocks in order to have really stable hormones. And detoxification, is there, a strain on the liver function here? Rapid fat loss and having the body to have to deal with the changes in the metabolism so rapidly. Functional lab testing. So again, as I mentioned, every patient of mine, when they first come to see me, I have them do a basic blood draw. I say basic, but it's actually a little bit beefier than just what you get at a physical. But I send all of my patients to LabCorp and I have them get a fasting blood draw. We're looking at comprehensive metabolic panels, CBCs, blood count. We're looking at a variety of inflammatory markers. I want to see how their body is handling B vitamins, vitamin D, magnesium, zinc. Are they having a hard time breaking down protein? It's so dense and it's almost like a puzzle. It's hard to pull apart. They're probably going to have a hard time managing something dense like a mineral. So I'm looking at all of that in a blood draw. And then really, like I mentioned, gut health can be addressed in a simple blood draw. I think functional medicine gets this complicated and confusing rap because it's like, oh, then your patients have to take thousands of dollars of tests. I don't do that. I don't even have them do SIBO tests. I have them do a blood draw. And when we are reading the labs from that functional and Eastern medicine perspective, again, we're seeing the microcosm of the body in that blood draw. It's so valuable. We can get all of that, the gut health almost can be addressed in that simple blood draw. Again, plus we're feeling their pulses, what's going on here. We're talking to them, we're seeing them on a frequent basis. Hormonal assessment, I always include a thyroid panel, a deep thyroid panel. I often do have people do a secondary test that's a cortisol rhythm test to see again what's happening with their waking cortisol into the afternoon. And sex hormones, depending on where they're at, I'm either having them do blood draws or I'm having them do cycle mapping at home. And as I mentioned, toxin overload, occasionally there is need for a heavy metals test, for instance. We're suspecting that they're being exposed to a large amount of arsenic. I have in one of my locations, it's an area where a lot of people have well water, and we do see some issues with the content of their well, and that is creating that added strain. So then we can do these additional testing, additional tests that just show a little bit more information. But we also can see a lot of that. How is the liver responding just in a blood draw too?
That's why you can read and see clearly.
Nope, I think someone has let's see. So, okay, so red flags to watch for: comprehensive monitoring beyond standard care. So we have be prepared and pay attention to rapid muscle loss without fat loss, worsening fatigue or mood. I'm sorry. So I have a dog that just came back from the vet. I'm in the middle of a live Zoom right now. Thank you so much. I have a lot of commotion going on right here in my house. Maybe you don't hear it. So red flags to watch for: worsening fatigue or mood. Definitely a concern. You want to make sure that you're paying attention to this. As I mentioned, it's not a established study, but there are reports of suicidal ideation with these medications. Nutrient deficiencies could be developing. Hormonal imbalances could be also emerging. So, Eastern medicine perspective, I want to talk more about really understanding that through our traditional wisdom, right? And looking at signs and patterns that we may be seeing with our patients. So, chi, metabolic function depends on a smooth flow of chi. What's happening there? Spleen chi deficiency, it's often an underlying cause of that weight gain and diabetes in the first place. And again, if we aren't addressing these root causes, the medications can only go so far, really, for our patients. So, spleen and stomach chi deficiency, I see this all the time in lab work that it's a common cause of that hypochlorhydria. It's that miscommunication of again, the enzymes from the saliva that help wake up the spleen and the pancreas that help wake up the stomach. So really making sure that if we see that deficiency there in that communication, we need to support our patients there. Kidney yang deficiency will certainly affect metabolism and transformation, and liver qi stagnation underlying is also often has led to emotional eating and cravings in the first place. So we're looking at a few, again, patterns here. Spleen qi deficiency, look for poor transformation and transportation. Dampness accumulation from a weak spleen function. Look for phlegm formation, pathological fluid retention, and kidney yang deficiency. Really that inability to transform fluids and help warm the digestive system. Other contributing factors, so lifestyle, irregular eating, as I mentioned, are they trying to do this intermittent fasting that's so popular for people, but the timing of it is really detrimental to the way that their body wants to function? Lack of movement, is it difficult for them to be able to move, whether physically or just their lifestyle? They are working, they're taking care of kids and people all the time. It's really difficult for them to have and find time for any sort of movement. When I talk to my patients, I usually don't ask them if they exercise. I ask them if they like to exercise, because I think that's a really important distinction, because many people don't like to do it. And I want to give them a little bit of a break. You don't have to like to do it. And we can help encourage them. Hey, maybe you just need to do some arm circles in the morning for 15 seconds just to get some movement, and it starts to catalyze from there. Other emotional factors, excessive worry, anxiety affecting the spleen. This excessive information, I think, that we're bombarded with right now with social media, news, it is incredibly weakening for the spleen. So we really need to be paying attention to what our patients are taking in, not just food, but in information. And then environmental, what's happening in, again, their home, what's happening in their environment where they live. There's all kinds of ways that can affect their overall Chinese medicine pattern. And constitutional, what is going on with their individual body type that can predispose them to this in the first place. So here again are some pros that we can talk about with the GLP-1 medications, how they can kind of align with traditional principles. So helping reduce food intake, it does lessen the burden on a weak spleen, for instance. Controlling appetite can help with emotional eating patterns, help with the supporting the spleen and the earth element. Weight reduction, it does often decrease dampness and phlegm accumulation, and we're able to stabilize blood sugar, which is huge for the spleen. Harmonizing chi flow, so also reducing cravings can help smooth the liver qi stagnation if they have that. Improving energy, that again, that weight loss really can enhance overall chi circulation. Some of my patients really report that probably the biggest thing. Their body has been able to shift into a place where they can then exercise, and they like to start to do more movement where it was hard for their bodies. Their bodies couldn't physically do it before. So it can help with getting that chi moving that has been stagnant. Emotional balance, better blood sugar control can affect mood, less ups and downs, less crashes, and sleep quality. Metabolic, improvements also help support rest. Okay, so concerns though, of course, this also could further weaken the spleen. I mean, we are artificially suppressing their appetite. This potentially does have weakens sort of the natural function of the body. We are not necessarily addressing the root with these medications. So more dampness retention because of that slowed digestion that can actually make those damp conditions even worse. Kidney yang damage, so just long-term use of any medication can really further weaken yang qi. And blood stasis, I do see some of that rapid changes all of a sudden affects how qi and blood is flowing, and then it creates more of that stagnant pattern. And again, just general concerns, as I mentioned, it's artificial intervention. It's kind of going against the principles of supporting our natural body's way of learning how to function. And it's symptom suppression. We, often with just taking GLP-1s, it's not addressing that underlying imbalance. Potential dependency creation, as I mentioned, that may weaken the body's self-regulating abilities off these medications. And really just kind of energetic disruption. How is the body now getting this medication, changing the way the digestive system is happening? What's happening with that communication, that energetic communication in the digestion? Okay, so integrative approaches, we're going to look at a case study here of one of my patients. We have Jeannie, is a 71-year-old female. She came to me after she had been on Ozempic for about 3 months, and it had what she called, it wreaked havoc on her digestive system. So she had been a chronic omeprazole user for about 45 years. She had chronic heartburn. She had been using that for a long time. She wanted to get off that immediately. But she still has chronic heartburn. So we talked about, that was a big piece of the treatment plan, but the Ozempic had been about 3 months. And when she started it, things were okay within the first month. And then 2 months in, it started causing pretty extreme IBSD. So really, really very frequent loose bowels up to 10 times a day. She also had that very typical coxcrow diarrhea, waking at 4 in the morning. It was really messing with her sleep because she had a history of primary insomnia, so a history of falling asleep. She was falling asleep late. And at least before she started taking these medications, she would be able to sleep in. She's retired. She was able to sleep in the morning. But now that her digestive system went awry, she was waking up at 4 a.m. So she was really getting very little sleep while she was on this medication too, which was a big piece to why she wanted to get off of the medications. She did like to exercise. She was active and liked to walk. Having the extreme diarrhea did make that difficult. And so she also did have some joint pain and mobility issues, but overall, she wanted to continue to stay and be really active. She was generally just stressed all the time. The other side effect of these medications created a lot of brain fog for her and memory loss, and she was very concerned. So she had a lot of concerns about what was happening if there was some sort of mental decline that was unrelated to taking this medication. Energy was generally very high, but of course, with the shift in issues with her being able to sleep and sleep in, she was very tired during the day and had to start taking naps pretty much daily. Her pulse, very deep, soft, and small in general. She did have a red cracked tongue with a thick yellow, greasy, slightly greasy tongue. And then I do I do the Hara diagnosis, and she had Okatsu, which is like a liver and lung communication point. So I think of it as like the way that her body is able to move qi and process qi through the body, through those two sort of detox organs. So here's the first set of my template that I plug in people's blood draws. Again, I go and have them do a fasting blood draw first thing in the morning. And when the results come back, I plug in their labs into my template. You see the test, the optimal range. So this is different than what it says on the LabCorp labs, the results. So the optimal range is a more narrowed range. This is where we're really trying to look at what is optimal before it gets into the diseased state. And where the conventional range is generally like normal. Abnormal means you're not in the disease state or you're in the disease state. So there's not a lot of preparation for trying to keep you from the disease state. So as you can see, lots of blood sugar dysregulation here. Fasting glucose is high. That's a number that's going to fluctuate. So I always add fasting insulin and the hemoglobin A1C. Those are two tests that give us a more accurate understanding of sort of the more long-term way the body handles sugars and blood sugar. So the fasting insulin is quite high, honestly, and over 12 in some conventional labs is considered abnormal, and over 20 is considered abnormal. So it's a really confusing number to use for many patients if they're relying on conventional lab ranges. So that's why we want it small, and we want to make sure that that fasting insulin stays at the lower range between 2 and 5. Hemoglobin A1C, that's the marker often used to understand and diagnose diabetes. Over 6.5 is considered diabetic. So right now she doesn't have technically diabetes, but there are still issues with the way her body is managing blood sugars. The CO2 number, that's a really good, helpful number. When it is low, it actually is an indication of acidity in the body, kind of like when we're stressed, we sort of are mildly hyperventilating. And so I often see this low for my patients that are stressed. We need to help encourage like deeper, slower breathing, because right now, because of her stress, her body is just tending to be on that more acidic level. Diving in a little bit more here, her minerals were pretty much within range. The alkaline phosphatase, this is along with the bilirubin, which is actually in range, but this is a high number. So that often indicates how the body is processing bile. There's some sort of bile duct inflammation issue here. We also see liver inflammation. So that AST number, that liver enzyme number is just outside of range. So we're starting to see inflammation, some chi stagnation, some heat in the body. We saw that red cracked tongue with the yellow greasy coat too. So what I think is super important too, always what's so key is that cholesterol needs to be within range, and there's not enough talk about low cholesterol. Because of timing today, the cholesterol and the lipids is like, it's a whole class in itself, which we talk about. It's actually, we spent 2 weeks on it in the cohort. But cholesterol is extremely important to monitor high and low. Low cholesterol is just as detrimental as high cholesterol. We really want to make sure that the body is getting those building blocks, especially for hormone regulation. So we see areas here where she's malnourished, and there's, again, continued liver inflammation. Moving along here, her white blood cell count is high. That's often a response to inflammation from like a diet in high refined sugar. She did have a lot of sugar cravings, even on when she was on the Ozempic. It helped with weight loss, but for her, it didn't really shift a lot of her cravings, and she still had a hard time with eating high refined sugars, candies, and like bread sugars and things like that. We see some macrocytic anemia in her red blood count, the way that the size of her red blood cells is large. That's called macrocytic anemia. It's harder for B vitamins to get into those bigger, beefier cells. So we consider that macrocytic anemia. We want to support her body in order to get those B vitamins, but we certainly see that she is blood deficient as well here. Now, looking at her white blood cells, again, this is where I think it's so important, again, without having to go down the rabbit hole of all these crazy testing, you can see that there's dysbiosis here. Most likely that small intestine is either leaning toward leaky gut or she already has leaky gut, and we need to treat that immediately. There's inflammation. The neutrophils are like the first responders. They often are released with leaky gut. irritations in the small intestine. We see lymphocytes, so her immune system is deficient because of that dysbiosis. And her monocytes, those can often be high for a lot of people. It's a generalized inflammatory marker. But again, the way that those are combined and how those are working together, we can really show and see there's an issue in that microbiome. There's an issue in the way her small intestine is supporting that last part of absorption. So we want to make sure to start treating that immediately. And then we have a little bit of iron deficiency here. We knew that too for the B vitamin, that macrocytic anemia. We saw that. So there's blood deficiency there. What's really important here is the highly sensitive C-reactive protein. As I mentioned, this is a test I always include, and it is really helpful when people have high cholesterol, because when they have high cholesterol, if their C-reactive protein is low, there's an understanding and studies show that there's less of a risk of cardiovascular disease. So that high cholesterol could be a response to hormone imbalances, stress, totally unrelated to any sort of like cardiovascular disease. So I always add this test. Now, what's interesting for her cholesterol is low. So we have low cholesterol. This is a reaction to some sort of inflammation in the body, and we want to suss that out. I suspect that it has to do with the leaky gut in her digestive system. Lastly, what I think is so special again about what we do when we can look at labs is we can read the thyroid. I mean, the thyroid is such a fascinating organ. It's so interesting that it isn't a dominant organ in Eastern medicine. And in my cohort, we do spend a lot of time talking about the thyroid and the 8 extra meridians and how that really helps understand the communication of thyroid hormones in the body. And what I think was really unfortunate with her is that she's had these labs. I looked back at some of her previous labs. She's had hypothyroidism for years, and none of her doctors were talking to her about it. This number, 5.13, it's very controversial, and it shifts for what is considered normal or abnormal. But we see by testing TSH, testing free T4, those are common tests that people do, but also testing that T3. Her body is that thyroid is under functioning. It's not making enough T4, and it's certainly not able to convert T4 to T3, which is a large majority of that happens in the gut. Because of that dysbiosis, could have been pre-Ozempic use. But because of that dysbiosis, her body isn't able to convert into that usable thyroid hormone, which is just going to be everything for how her digestive system works ultimately and how her body manages stress overall. So this is just a really kind of a quick and dirty version of the labs that I look at and how I use Eastern medicine and functional terminology to build a treatment plan for patients. So for Jeannie, her treatment plan, again, or I'm sorry, report of findings, we see hypothyroidism, as I mentioned, liver inflammation. So we have that elevated alkaline phosphatase and AST. I realize we're going to go over. I'm going to continue to record. And if anyone can stay on, please do shoot me messages in the chat. If you have to hop off, shoot me messages and I will respond to you, I promise. But we also see blood sugar dysregulation. So we have elevated fasting glucose, that insulin, which I spelled insulin wrong here. There's no E in that. I'll change that. And then again, that really important decreased cholesterol markers. Those are so important to pay attention to. We have that high sensitivity C-reactive protein, marked elevation, some dehydration markers, and just overall inflammation. From an Eastern medicine perspective for her, we have that liver yin deficiency with qi stagnation. Qi stagnation is going to also inhibit the body's ability to convert T4 to T3 in the liver and the gut. Liver blood deficiency, which has that brain fog, those iron deficiencies, the body's not able to move that inflammation out of her system. We see some liver attacking spleen, diarrhea with abdominal pain, high stress. And again, as I mentioned, blood deficiencies, marrow deficiencies. We have that kidney yang deficiency with that coxcrow diarrhea. So here's a variety of patterns that we're working on for Jeannie with her treatment plan. So her treatment plan, weekly acupuncture. Every one of my patients, after we do labs, I'm like, okay, I want to see you once a week for 3 months at least. I need to be able to check in with them every week. I need them to know how important it is in order to really dial in the treatment plan like this. I want to check in. I want to be feeling their pulses. I want to be hearing about changes in their body every single week. So that's a huge kind of non-negotiable in a way with my patients. Of course, I can be flexible, but I really, really find the best results are when they are seeing me weekly. Gentle liver cleanse. So we did a really mild liver cleanse for her. We also talked a lot about the clean 15 and the dirty dozen, trying to get her on a more organic foods diet, trying to eliminate toxins in her household with products and all of that too. We addressed the hypothyroid issue with supplements. There's a really incredible herbal protocol for underfunctioning thyroid. The thyroid medications I would consider another bridge tool, and I'm certainly not opposed to my patients getting on those. And she was very, very insistent on not getting on any sort of hypothyroid medication. So I'm here to work with her with that, of course. And I find that herbal protocol is incredible for underfunctioning thyroid. And if I have a patient, I give them all the information. I want them to know what Armour thyroid does, what levothyroxine, synthroid. I want them to know so that at least they have that informed decision. The Chinese herbal formula that I use is Taoxiang Yaofang. I'm sorry, Tongshe Yaofang. This formula actually I have in the resources list has a really interesting study on how effective it is for treating IBSD. And this really just kind of worked with a variety of her patterns. Hydration, adequate water intake to help support detoxification and just make sure that she was actually really drinking enough water with electrolytes and supporting her body in that way. Okay, so we're kind of just reiterating here. I also, with all of my patients, we're making sure they're trying to sleep regularly. They're getting some sort of stress reduction or stress coping skills on deck. They're able to get some movement. Again, a lot of my patients, I just say, let's just start with like 15 seconds of circles every morning. Let's start with like some little easy Qigong moves and help build kind of like get that movement to catalyze forward. And then hydration. I'm always getting people to drink more water. Functional medicine support. This is kind of like an Eastern medicine support and integration. Again, analyze those that nutrient absorption and blood work that can show you all the answers again with one simple blood draw. It is so much easier than you think that it could be. Protein prioritization. I want to make sure that they're getting quality protein and actually absorbing it, which is what we see in lab work often. People are eating protein and their body isn't actually even absorbing it. And it's really difficult for their digestive system to even break that down. Again, probiotic foods, digestive bitters, gut healing protocols, stimulating that activity of the saliva to wake up the pancreas, to wake up the acids in the stomach. Sometimes we need a gentle liver detox, especially during really rapid fat loss too. Again, acupuncture weekly sessions. Let's get everyone getting weekly acupuncture. It's so key for that stress response, that parasympathetic mode, the rest and digest. Herbal medicine, treatment for spleen, stomach, kidney. Again, more movement, meditation, or some sort of stress reduction. Basically stress reduction practices. I'll leave this open for a few minutes here. These are just some other ways of supporting your body's own natural GLP-1 production. So whether patients are on medications, whether they're not, there's so much that you can do to start to stimulate that activity, whether they are getting on, off, or deciding where to go from here. So lots of fiber, protein, again, making sure they're breaking that down, healthy fats, fermented foods, digestive bitters, as I mentioned. Those are some of my favorite ways of really supporting the digestive system, tapping into that natural communication. That's what those GLP-1 medications are trying to do, and they do. So we can help stimulate that on its own too. Okay, so we're getting to the question answer period here. I just wanted to thank you all again for joining me. As I mentioned, I have a fall cohort starting September 15th. I'm super excited about it. It's a really cool group of people. It's 8 weeks. You will master functional blood testing and really elevate this new offering to your practice. It's an 8-week program. 2 weeks we cover every 2 weeks we cover one topic covering an entire blood draw. And I just think that this has been really transformative for me. I'm in California. It's very easy to run blood work. I have my patients again, they just go to LabCorp. I use a third party to make those labs really, really, really affordable. Or I'm able to just take their labs that they're already getting, and we can analyze those from that basic blood draw. So I hope that you join me. I'll be sending out some information more about that. The early bird pricing does end on September 1st, which is next Monday. And if you have any questions about the program, please reach out. I'm just so excited. I could talk about all this stuff all the time. And now we're going to get to some questions. Let me get to the chat. Give me one sec here. Okay. I don't have any questions here. If anyone wants to shoot a message, please do. And I also will be, of course, sending out CEU certifications at the end of this week. You should be getting them within the next couple of days for all of those who need the CEU from today. But if there are any questions, really, please do not hesitate to reach out. You have my email. I am here to answer any questions about this, about my cohort, about lab work in general. I could talk about it all day long. And again, my cohort is the beginnings of this integrative medicine curriculum for the bridge and the doctoral program. So it's the next step in between those two. All right, well, let's see. Okay. Do I need anything else for your CEU? Nope, I'm just going to be sending that out to the email on file, and you'll be getting that again later this week. And again, last question or last thing I just wanted to say, recording will be available for the next 48 hours. All right, thanks everyone. Have a lovely day, and I hope to talk to you all soon.